Because there are some time-sensitive announcements that I sadly have to make. First of all, I'm joined by the Chief Health Officer, the COVID Commander and the Chief Commissioner of Victoria Police. They'll each speak and be available to answer questions. First of all, there are 77 new local cases of coronavirus across our state. 61 of those were mentioned in the tweet this morning. There's a further 16 cases that will be in tomorrow's data because they were done as a rapid test, a PCR test, but a rapid test on site. They didn't go to a laboratory. They are all in the Shepparton area and are part of a very concerning Shepparton outbreak. I'll come back to that in a moment. But that takes to a total of 77, the total number of new cases that we are dealing with today. Just 22 of those were in isolation for the entirety of their infectious period. That takes to a total of 389 the number of active cases across our state. There are 18 people in hospital, 8 in ICU, 2 on a ventilator. We wish all of them well. Pleasingly, 45,670 tests. Those results came to us overnight. I thank each and every one of those people for getting tested yesterday. It's such an important thing, and I again commend to every single Victorian, any symptoms whatsoever, please get tested. And please get tested without delay. We will get your results back to you, 99% of results, the following day. If you're going to be down a day's wages because you're waiting for a result, hopefully a negative result, there is a $450 essentially no questions asked payment. And if you are positive and you're going to be out of pocket, there's $1,500 for the 2 weeks that you'll need to spend in ISO. So there's no financial barrier. There's every good reason, and it is essential that people come forward as soon as they register symptoms. There are, in the cases we're reporting today, there are, unfortunately, some people, and we can't change this, but it's worth noting, there are some people who have not been quick to get tested. They have perhaps had symptoms for a period of time, and unknowingly they have spread this virus. So it's really, really important that everyone who's got symptoms goes and acts on those symptoms, goes and gets tested as quickly, as soon as they register those symptoms. There were 29,539 vaccination doses administered yesterday, and I'll come back to vaccinations at the end. But I'm sure what everyone is waiting to hear, sadly, the public health team have advised that given the Shepparton outbreak and the fact that at least one person travelled to Bendigo and potentially others travelled beyond, that is to say there's a very significant risk of transmission right across regional Victoria, not just in that Goulburn Valley area. From 1 p.m. today, all of regional Victoria will move to the same lockdown conditions as exist in Melbourne right now, with one important exception. The curfew will not operate in regional Victoria because I have no advice, given the disparity between the risks in Melbourne and the risks in regional Victoria. I have no advice to put a curfew on in regional Victoria. So from 1 p.m. today, and we know that is a very quick, and that's not a lot of notice, we fully acknowledge that, but this virus moves so fast and there is a significant risk out of both the cases we know about in Shepparton, what we don't yet have confirmed but we suspect has happened in Shepparton and beyond. This virus has made its way from Sydney to New Zealand, for heaven's sake. We therefore shouldn't be having any of these debates about whether the whole of the country of Victoria is at risk. The judgment of our public health experts is that it should be statewide, and on that basis, that lockdown, those 5 reasons to leave, will apply to all of regional Victoria, just as it does apply to all of Melbourne. I absolutely regret that that's the case. That's the decision we have to make. But that is the advice we've received, and that none of us have the luxury of ignoring the science or ignoring the evidence and the recommendations of our public health team. Now, in terms of some further changes to rules as they operate in Melbourne, we have seen, and Jerome can speak to this in more detail, we have seen a number of transmissions in and around childcare centres. We have seen a very large number of young people, and some very young people, become infected with this virus. This is a feature of these outbreaks. It's a feature very much of Delta and a feature of 2021 as it compares to 2020. And not just here, but in the ACT, in and around Sydney, and indeed right throughout New South Wales. So I'm announcing further changes to childcare. So we will move to a permit system where only authorised workers will be able to send their kids to childcare, and those who have vulnerable children. We will work through all the detail of that over the course of the weekend. There'll be exact words up on the website. There'll be a process for people to follow, but it's essentially going back to the process that we followed last year, which was very successful. I know challenging, but very, very successful. We have got to limit the number of kids that are in our childcare centres. We have got to limit the amount of movement that is occurring that involves our smallest children. There is also some recommendations which Brett can speak to in relation to masks, not just for older kids and adults, but for primary school aged children as well. Not a legal requirement, but an advisory for younger kids. And I'll let Professor Sutton speak to that in a bit more detail. There are also some changes. Those childcare arrangements apply statewide. There are also some changes to industry settings as they exist in Melbourne. A number of high-risk industries will not be able to operate at 100%. They'll have to reduce, just as the construction sector has done. Construction will be reduced to 25% across the whole state, so that'll happen in regional Victoria. There'll be a little bit of time for that to occur. We will work with industry to deliver that outcome. But things like abattoirs, meat processing centres, very large supermarket distribution centres, cool stores, things of that nature, exactly the same settings as were changed last year. They will be under new arrangements to limit movement and to limit the risk of widespread infection. In Melbourne, they will move to those settings as part of the announcements I'm making today. I can't rule out further adjustments to those industries in regional Victoria, but I'm not announcing any of those as of this press conference. We're looking at that, and if we have to do more there, we will. So in essence, regional Victoria from 1 o'clock today, same rules as Melbourne, except there's no curfew. Curfew remains, and all the other rules remain in Melbourne. There are then some industry-specific changes in Melbourne. We may need to go further than that and make some of those statewide, but we're not announcing those today. We will reach out and speak with all those industry stakeholders and make sure that they're fully briefed. We will have also an authorised worker permit system that operates just like it does in Melbourne in regional Victoria. But just as there was a grace period to go and get those permits in metropolitan Melbourne just a few weeks ago, there will be the same grace period in regional Victoria. So from tomorrow and through not before midnight Monday, there'll be time to get a permit, but only authorised workers will be able to leave the home if they've got a permit and are on that list and are authorised to not be working from home. So there's quite a lot in that, I know. Essentially, it is the same rules applying across the state because we have virus across the whole state, and we need to limit movement, to limit the spread of the virus. There'll be, I know, lots of questions that come out of that. We will reach out to every single stakeholder, every single interest group, all of those professional associations and others, as we always have. We'll be indebted to you guys for the role you play in getting those messages out to people so that there's clarity. But there'll be common sense from an enforcement point of view. We know this is a big switch up in regional Victoria. People need to follow the rules, but of course we do understand that it's just not possible to give people a very long notice period. I apologise for the inconvenience of that. There's simply not a choice but to follow the advice and to act as we have today. Now on Shepparton, we would ask, Jerome will speak to this in a bit more detail, but I know the Shepparton community, they've done this before. They will come out in droves to test. They will do the right thing by all of us. They've done it before and they'll do it again. There is some specific requests of the Shepparton community about who comes forward to get tested and in what order. I'll let Jerome speak to that, but essentially if you're not proximate to these schools and childcare centres, if you're not proximate to the outbreak, if you've not got a connection, you don't need to test now. You should isolate at home. We will give you further information and we'll tell you where to go and get tested. It's the people who are connected to these cases that we want to come and get tested today. Then there'll be a time for the broader Shepparton community to come forward and get tested, and I know they will do that. We saw a quite amazing response last year, and I'm sure that the Golden Valley will step up again just as it did last year. Beyond that, my message is one of absolute clarity. We all have a part to play. It's a beautiful day today. Tomorrow's weather's going to be the same. These are some changes but it's the existing rules, complying with the existing rules, not necessarily, books full of new rules. It's following the ones we have now. It's following and playing our part, all of us, sticking together and looking out for each other by following these rules today and tomorrow. That's what will keep these numbers relatively low in comparison to New South Wales, for instance, and will drive them down even further and mean that we are locked down less rather than more. There is every reason for us to be confident. There's every reason for us to look at the data. We've done this before and we'll do it again, but only if we all do as we need to do. Play our part, follow the rules, do the right thing. Don't assume that the rules are for someone else to follow. Please don't assume that you don't have it and you could never get this virus. That's not logical. This is across Melbourne and it's into the regions, and we all need to take it seriously and we all need to act accordingly. And the rules will protect life, and it will mean that if we follow them, we can drive these numbers down and be open again. Just finally, we know that in times like this, it is a prompt for people to go and get their first dose, perhaps go and get their second dose. I just want everyone to be very clear. There are vaccine appointments available right now. And to give people a sense of that, over the next week, there are 79,750 vaccination appointments, 2/3 Pfizer, 1/3 AstraZeneca. Give you a couple of examples in a local context. There are, at the Frankston Community Vaccination Hub, for instance, over the next 7 days, there are 7,187 appointments. At the Old Ford Factory at Geelong, there are 7,186 appointments. Melbourne Convention and Exhibition Centre, 5,370 appointments. Melton Vaccination Hub, the indoor component, not the drive-through, 4,969. And finally, the Sandown Racecourse out in the southeast, 3,454 appointments available in the next week. Go online, make a booking, turn up, get vaccinated, and be part of that important race to 80%, so that we can be open, so that lockdowns are a thing of the past. That is absolutely achievable, but we all have to play a part in following the rules today. Lockdowns are our short-term weapon against this, but our long-term strategy to be open, to be growing, to be employing, to be in a very different world is for 80% of people to be through that vaccination program. You can act on that right now. Right now. Book with confidence. We have the supplies to meet those appointments. We don't have enough vaccine for everybody, but we certainly have appointments that are not filled as I stand here right now. And just finally from me, these decisions are never made lightly. They are on advice. They are about stopping this getting fundamentally away from us, and then there is no pulling it back. A situation much like what's occurring in New South Wales, sadly for them, and indeed for all of us, because their problems are essentially our problems. That's how this virus works. But please get tested today if you've got symptoms. Please follow the rules. Please make good choices for your family and every family. The fact that it's a sunny day doesn't remove the risk. It doesn't give anyone a leave pass from playing their part. We all are in this together, whether we like it or not, and we all need to play a part and contribute to driving these case numbers down and not do anything that might see more infection rather than less. Can I now throw to the Chief Health Officer for some comments, and then Jerome can take us through the individual cases and give you some of that mapping of the outbreaks. And the Chief Commissioner's here to speak about compliance as well, and we'll take any and all questions you have. Over to you, Brett.
Thanks, Premier. A difficult day in Victoria. We know that we've got new cases in regional areas. Shepparton, certainly we know of many cases. We also have a number of mystery cases across Melbourne who've been infectious in the community for days, in part because they weren't aware that they were primary close contacts. They have tested because they're symptomatic, but they have not been quarantining because they were not known to be primary close contacts. We have really significant challenges with the Delta variant. The number of people who get infected within households is close to 100% in many of the households we're seeing. It moves very quickly. That is now known around the world, and that's very concerning for myself, for the public health team, as are the cases in Shepparton. It does show that regional Victoria is under threat, and it's likely, with the significant movement for essential reasons, to have gone beyond Shepparton. That's why we've declared that all of the current restrictions in metropolitan Melbourne will now apply, other than the curfew, to regional Victoria from 1 p.m. today, and they'll be in place until the 2nd of September. Also from 1 p.m. today, as the Premier suggested, the childcare centres across Victoria are closed, other than for the supervision of vulnerable children and the children of authorised workers. And these restrictions will help us drive the numbers down. They've worked previously. They worked last year, if we can follow all of those rules. As you know, there are 5 reasons to leave your home. This will now apply in regional Victoria: to get the food and supplies you need, to exercise for up to 2 hours and no more than 5 kilometres from your home, for care or caregiving, work or education if you can't do it from home, and to get vaccinated at the nearest possible location. You will need to get a permit for authorised work, but there is a 1-day grace period, so that is not required until midnight tomorrow. And the permit application's on the coronavirus website. It'll be updated today when the directions are signed to reflect its use in regional Victoria. Face masks remain mandatory outdoors and indoors, but not at home, unless an exception applies. And that applies to all workplaces and secondary schools. Masks will not be able to be removed to drink alcoholic beverages. We're also recommending, as the Premier said, not mandated, but recommending that children of primary school age also wear a mask in indoor areas. That's particularly reflecting on the Delta variant, on the fact that we've seen significant transmission between young children and the overrepresentation, really, of young children in our current cases. It aligns with the WHO advice on masks. It absolutely aligns with the Centre for Disease Control in the US, CDC, that also recommends masks for children, they say 2 years and above, in school settings. We're talking about primary school children. I'm reflecting on how challenging it'll be for very young children. It is, for that reason, a recommendation. Some kids will do it, some kids will do it well, some kids will absolutely not be able to do it. But as a recommendation, and if your child is able to do that, that will help protect them. It'll help protect those settings where transmission between kids occur. Not every parent will have a mask that's available, the right size, the right fit, but understanding this recommendation, please look into it and see if you can find a mask that your child will wear and that remains something that they can sustain to protect themselves. It is a small but very highly effective tool. We've seen so much benefit from the use of masks, and understanding the significant transmission that happens between young children, we think that can make a big difference as well. But more than ever, it's really important that visitors do not occur to your home. This is where transmission is still occurring. The virus spreads when people gather indoors for prolonged periods of time, and we're seeing it time and time again. These are significant and really tough decisions, but we are buying time. We are doing what we know works, because a transmission saved today is 100 cases, 1,000 cases saved a month from now. That is people saved from hospital, saved from ICU and being on a ventilator, and saved from dying. So everything that we can do at this critical juncture, with relatively small numbers, fewer than 400 active cases in Victoria, is a really, really important time to do everything that we know that works. With relatively small case numbers, the effect of higher vaccination coverage is even more powerful. When you've got very substantial transmission, the vaccine will start to turn it around, but it's much more difficult. With lower numbers, with less transmission, getting to that 60, 70, 80% two-dose coverage is a much more powerful intervention to turn transmission around. They are hard decisions, and we know that this is a tough day for Victoria, but we also know what works. So please follow the restrictions. Please get vaccinated. Book in now. This is our golden window to get to the fastest two-dose coverage that we possibly can. and please stay safe. Thank you. Jerome.
Thanks, Brett. Good morning. A challenging day indeed. 77 new cases today. That takes us to 402 active cases of coronavirus here in the state. As the Premier said, 18 Victorians in hospital, 8 in ICU, 2 of them are on ventilators. We send them all of our best wishes. We also note that those numbers are now starting to increase. We have about 8,855 primary close contacts identified at this time. A significant number of PCCs came off yesterday or the day before, and around over 10,000 secondary close contacts, all of whom are isolating in support of these outbreaks. Of the 77 cases today, 31 are in 2 large and rapidly growing clusters. 14 cases are in the Broadmeadows My Centre Childcare Centre. That's in addition to the 13 we identified yesterday, so that's 27 cases just in the last 2 days. And 17 are in Shepparton, and I'll come on to that in a moment. So that's 31 cases across those 2 clusters. We have 35 cases linked to the existing clusters that we've been talking about over recent days. 22 of those were in isolation. The other 13 are various new cases, new primary close contacts, or cases identified through contact tracing who had part of their infectious period in isolation, but not entirely. Those existing clusters include Altacqua College on the day 13 testing, Glenroy West Primary School, the Newport Footy Club, and those kind of exposure sites we've been talking about for a while. That gives us 66 cases in total for today. We then have 11 separate unlinked cases that come across a wide geography of Melbourne, including Airport West, Frankston, Keysborough, Docklands, and Yarraville. We are still working to link those cases and to also identify any downstream exposures. So we can see that with the scale of the cases we've seen today, the large number of unlinked cases and 2 large and dynamic clusters, one at Broadmeadows and one at Shepparton, that this is now a rapidly escalating situation, and hence the decisions made by the Chief Health Officer around the further restrictions to be imposed. 7 days ago, a week ago, we were only talking around Newport, Caroline Springs and the school outbreaks. We had a total of 161 active cases in the state at that point in time. At that point in time, St Kilda East, Shepparton and Broadmeadows were already seeding. Unbeknownst to us, we already had active cases in those 3 clusters. And that highlights the importance of that early testing protocol. As soon as people become symptomatic, you absolutely must get tested, given the numbers that we're seeing emerging today. In all these cases, in all those examples, we've got evidence of people waiting a significant period of time before getting tested and having infected a large number of people before they have got their test results. In terms of Shepparton, we have 17 cases identified so far, all identified yesterday. The first positive case was identified yesterday morning through our normal lab processes. 16 of those positive cases came through rapid testing on site using our mobile PCR capabilities. Those 16 cases will be in tomorrow's numbers. Those 17 cases in total are spread over 3 households. All the individuals in those households are now COVID positive, with significant links into a number of schools, in particular St Mel's Primary and Greater Shepparton Secondary College, across a number of different sites. Those are clearly large school communities. There's a lot of contact being made through those school communities, and of course we're encouraging everyone to come and get tested today. We have 3 testing sites already up and running in Shepparton, including the Goulburn Valley Health Acute Respiratory Clinic on Graham Street. There's now a new drive-through site at the Shepparton Sports Stadium on Newmarket Road. And we also have a drive-through testing site at the Greyhound and Trotting Track just outside Shep. As the Premier said, we are encouraging particularly those people who are being identified by our contact tracers and those related to the exposure sites that are already listed to come forward for testing today. If you are not associated with those exposure sites, if you're not associated with those schools, if you do not have symptoms, please do not get tested today. We want to prioritise those people who are symptomatic and those we're most concerned about. We will, of course, maintain this testing effort over the coming days and ensure everybody in Shepparton who wants to get tested can do so. Pleased to report we had 170 tests completed already this morning before 10 o'clock. I think queues at the moment around 2 to 3 hours at most of those 3 testing sites. We've also got at least one case from this cluster of 17 who travelled to Bendigo. We've enlisted Dilacas, which is an agricultural vehicle supplier, on Morong Road in West Bendigo as an exposure site. We will be setting up more capacity for testing in Bendigo during the course of today. Please keep a close eye on those exposure sites as we start to identify other potential movements across regional Victoria over the coming days. We're also, of course, seeing widespread community transmission now across the suburbs of Melbourne. And yesterday I spoke to this point, and we've seen more suburbs pop up again today. So we now have new cases emerging in Keysborough, in Frankston, in Mordialloc, in Kew, in Fawkner, Airport West, all the way across to Melton and down to Point Cook. That is pretty much every part of Melbourne now has positive cases within it, and there will be exposure sites somewhere near you. And I would please implore all Melburnians now, you have to be aware that COVID is now circulating in a community near you, through your workplace, through your place of residence, and through your other household and family associates. It is so important now that we abide fully with these lockdown requirements that we do not see any further transmission at this point. As Brett has said, any case we can stop today, any case we can stop in the coming days, stops us from having hundreds and thousands of cases in the weeks and months ahead. And we do not want to go to that place again. In terms of age profiles, a quarter of our cases are under the age of 10. 44% of our cases are under the age of 20. Half of our cases are aged between 20 and 60. And only 4% are over the age of 60. This does mean, of course, that it's every single Victorian is now at risk in terms of your age group and the kind of movements that we see around. We have, of course, in place a strong response around how we deal with this escalated situation. And I'd echo the Premier's words, please go out and get vaccinated. We have 138,000 Pfizer appointments available over the next 4 weeks. 140,000 AstraZeneca appointments available over the next 4 weeks. Please use those. There are at least 52 clinics to be able to get vaccinated. This is our strongest and best defence against a further outbreak. We have our 9 local public health teams escalating and scrambling more resources to throw into the contact tracing effort as we see more locations going live. My thanks to all those local public health teams for the very strong response they're putting in place. We, of course, continue to support high-density public housing towers. We have 4 significant public housing towers in Melbourne, in Collingwood, Richmond, Carlton and Flemington, who are all being supported. Again, positive cases that we identified another one yesterday, are being moved into hotel quarantine. We will continue to support people who are in isolation, and with over 20,000 people now, primary and secondary close contacts, who are in isolation, we will continue to support you. It is so important now that you maintain your isolation protocols, so if you need any extra support, please contact us through the coronavirus hotline. We made over 800 home visits yesterday, and again, compliance has been good. So we know that the people that we're working with, we know the people that we're tracing are doing the right thing. However, what we need everybody to do is to get tested when they're symptomatic. That can be the only strongest message from me today. We are seeing too many people waiting too long to get tested. 45,000 people got tested yesterday. We need to see people getting tested at the beginning of their infectious period, not a week or so in. We also continue to test at Sunshine West Industrial Estate. Again, we've seen some wastewater detects there. That work continues on. In terms of the message to all Victorians now, and I mean not just Melburnians, but all of us, please get tested, get vaccinated, and if you're not doing those 2 things, please just stay home. I'll hand over to the Chief Commissioner.
Thanks, Jerome. Just a brief update on what Victoria Police is doing to support compliance with the Chief Health Officer guidelines. As you would be aware, we have significant numbers of police out and about in the community. We're involved on the border with border control from New South Wales, with the division currently that still exists between Metro and rural Victoria, in hotel quarantine, with our Sentinel patrols that are out and about, and also with the launch of the Operation Shielding teams this week, over 200 police and PSOs out and about in public spaces, in shopping centres, making sure people are complying with the guidelines. That's over 1,600 police and PSOs out and about doing what they should be to make sure people are complying. This is a significant input by us, but we see on days like today, as we saw last weekend, the weather's out. When I say the weather's out, it's a beautiful sunny day in Melbourne. People want to be out and about. This is not a green light to be out and about partying or enjoying yourself. You must comply with the Chief Health Officer guidelines. All those shielding teams will be patrolling and we will be enforcing, as I've said. So please comply. I implore you to do so. We will do what we need to do, though, and there's significant fines in terms of gathering. $5,452 for a person who is involved in a public or private gathering that they should not be. So just comply with those guidelines, please. Having said that, in the last 24 hours, we've issued around 70 infringements. A couple of those examples, I mean, we've seen curfew breaches, we've seen people go to rural areas where they shouldn't have, a couple of those, to Warrnambool, to the Surf Coast. There have been mask breaches, obviously, and outside 5 kilometre areas. So that is concerning, but nonetheless, by and large, the public has been quite reasonable in their compliance. A couple of examples I would say in those 70-odd fines. We saw, disturbingly, at Southland Complex yesterday afternoon, a protective services officer, when they were issuing an infringement to someone for a mask offence, they were punched, they were assaulted and received a small cut. They're okay now, but it's that type of totally unacceptable conduct. We see as well at 2:30 this morning up at Sebastopol near Ballarat, we were called to a noise complaint. Saw a couple of people coming out, investigated. There were 10 people who were playing pool, drinking, partying without any masks. Every one of them gets that $5,500 fine. It's ridiculous behaviour, especially when you hear the warnings and we've got this spread and this transmission in the community. So again, I would just urge people, do the right thing, but if you're not, we will be infringing. And lastly, I want to deal with the demonstration that's supposed to be occurring here today. It's tagged as a freedom demonstration. It's anything but. It's just selfish. The reality is we don't know how many people are going to turn up. There's between 200 and 5,000 people that could turn up. We're trying to do what we can in terms of identifying how many people, but through encrypted applications, that makes it difficult for police. I have over 700 police on top of the other police you're already seeing in the community, another 700 who are specifically tasked at this demonstration. They've been out there this morning already. Already when I came into this press conference, we'd issued 6 infringements to people who are outside their 5 kilometre area in the city who were believed to be going to this demonstration. Please do not attend this demonstration. The risk of spread of the virus is significant. My officers will do everything they can to hold those people to account who do attend when they shouldn't be. No one should be protesting at this time. Significant fines. Every protester who we can identify and who we can apprehend will receive a $5,500 fine. That is, it's just ridiculous to think that people would be so selfish and come and do this. So we'll do the right thing from a policing perspective. I hope we don't have to give out any infringements at all. But obviously, in addition to the ones we've already given out this morning, but the reality is people are going to come in. I implore you not to do so. We have significant numbers stopping people at train stations, at other checkpoints right across the city. I'm happy to take questions, but I think we cross to the Premier first as the standard sort of procedure. So thank you.
Thank you, Chief Commissioner. If I can just simply add, protesting doesn't work against this virus. In fact, it may well contribute to the spread of this virus. And the more cases we have, the longer we'll be locked down. We need to get the community vaccinated. There are appointments available. In the meantime, we need to follow these rules. There's simply no choice. If there was another way, then we would choose that way. We would go down a different path that is just not available to us. If we want our hospitals overrun, and I just make the point, nurses and doctors and ambos, the whole team up in Sydney, they will be doing it so tough, even with 500-600 patients, COVID patients. That is enough to put massive stress and strain on any health system. We were there last year. We don't want to go back to that. We do not want to go back to that, and we're determined not to, and I think we've got every chance of avoiding that. But we all have to play our part. As tough and as difficult as this is, we all have to play our part, and I'm confident Victorians will. Any questions?
Just on childcare, does that include kinder?
It's the same arrangements as last year, and we'll get you, because I know there's different forms of childcare, long, daycare, we'll get the exact set of words, but it's the same arrangements as applied last year. That is to say, authorised worker, you'll need a permit, It's not a matter of having an argument with your childcare provider. You'll either be eligible or you won't, and you'll have to attest to that. We know that this will not be easy. We know it'll be very challenging, and in advance, we thank parents for that extra effort. I would just say as well, no parent, I think, wants their child to get this, and we do see significant activity and transmission around childcare centres. And we do see, as Jerome just noted, and not just as a feature of this outbreak, but Andrew Barr yesterday reported about what's happening in Canberra, much younger people. The data out of Sydney is very clear. The data from right across the world is very clear. Many young people get this, and we can't be certain what that means for them now and into the future. So we have to do everything to protect them.
And have there been discussions? Have there been discussions, maybe with the federal government or with childcare providers, about waiving fees during this point?
No, not at this stage. But there'll be, for instance, business support will be announced very soon. We know that we are extending these measures into regional Victoria, and there will be an economic cost with that. And the Minister for Industry Support will be out as early as tomorrow, certainly by Monday, I think, with a package of support. And we'll be talking to the Commonwealth about that and many other issues. I do note, it is just a matter of fact, that when we had these arrangements that limited the number of kids that could go to childcare last year, and I believe it was all forms of childcare, but we'll get you those exact words. When we had that last year, there was a kind of an industry backstop. There was money provided by the Commonwealth Government for that industry. That's not the case now. They're the sorts of things that we'll be talking to the Commonwealth about.
And what about in-home care, grandparents,
relatives?
Yeah,
all those same rules that applied last year will apply again, and we will get all of those words. And we think this is much more a feature probably from Monday in terms of the working week, but there'll be some people who will be affected quite soon by the decisions we've made. We'll get the forms of words and all of that clarity out there as quickly as we possibly can.
You took a proposal to National Cabinet yesterday.
Sorry, there's literally all of you asking this. Was it the same question? No, you're all asking different questions, I think. So why don't we go, Annika, first it's you.
You took a proposal to National Cabinet yesterday to get children aged from grade 6 through to year 12 vaccinated by the end of the year. I wondered if there was much support for that and backing, and
I think
how
that
close we are to actually
getting
that happening.
I'll leave announcements about National Cabinet outcomes to the Prime Minister, but I'm surprised he hasn't. If he's not already gone to this, I'm sure he will, and he won't mind me making Victoria's position very clear. We aim to have all of our 12 and older, so our grade 6s, right the way through secondary school. We want them vaccinated before the end of the school year. Whether that's achievable, that'll be mainly the biggest challenge there will be, do we have enough vaccine at the right times? We certainly hope we do. We would aim at least, I think, to have a first dose throughout all those age groups. Just logic tells you, if all those young people who are quite mobile and moving around doing lots of things and they go off on summer holidays and they haven't been vaccinated, then that's going to contribute to the spread of the virus amongst the other unvaccinated people. Plus, it's not good to get, and we think schools provide us with a formal environment, a structured environment where we're able to do that. I would also make the point that teachers, the vast majority of teachers, as I'm briefed, and staff are, because of their age and because of special provisions around classes that have got kids with special needs in them, for instance, vast majority of teachers and staff are in fact eligible to be vaccinated now, and as I said, there's the best part of 80,000 appointments available just this week. I would encourage anybody who can get to one of those appointments to do so. I won't make National Cabinet announcements, but I will say that what we put forward was very broadly supported, and I think everybody's working to the same aim, to get our kids, get our teenagers, our school kids from 12 and up, get them vaccinated before the end of the school year.
Premier, are you aware of reports in Melbourne hospitals of COVID-positive patients who are refusing to wear masks and are walking up and down wards?
Yeah, I have seen some reports of that. I don't have anything to add other than to say, look, we know that there can be some challenging behaviour, and that can be the product of many different things. Many people who present to hospital, will do everything that the staff ask them to do. Other patients present with history and complexity and all manner of different challenges. We know and understand that. They're very complex environments. The vast majority of people in hospital environments, not just patients, but visitors, staff, those who are coming in and out to perform professional services, they're doing the right thing. And that's one of the reasons why we have so few cases in our hospital system now. I just urge everybody to do as you're asked. If a health professional asks you to comply with certain tiered approaches to infection prevention and control, they're asking because they're polite. It's actually mandatory. You need to do the right thing for your health, your safety, and the safety of everybody else, particularly the safety of those people, those women and men who are caring for you. We should do everything we can to support them.
Is there a cluster inside the Royal Melbourne Hospital at the moment?
I think there are some cases that Jerome's gone to, and he can maybe speak to individual cases. But we have some, for instance, Werribee Mercy. There's been some people have been through the ED there that were infectious while they were in the emergency department, so they'll be furloughing there. They'll be furloughing at other hospitals as well. I would also just make the point, we're not making changes today to elective surgery, but there may well be disruptions on a hospital by hospital basis, depending on the sort of work they have to do to deal with any cases or any risk that might be in an individual hospital. But we don't have a widespread challenge. But if we were to let these rules off, or if we were to get complacent about infection prevention and control, all of us, then of course we would. And you look, the more cases, I think I went to this yesterday and I've certainly mentioned it many times, the more cases you have in the community, the more likely it'll get into your hospitals in a widespread way. And then we have further challenges in providing care to all patients, not just COVID patients, because you've got literally thousands of staff who are at home in ISO. Makes it really, really tough.
Premier, did you consider, or did the Crisis Cabinet consider banning takeaway coffee and takeaway food and further restricting exercise? And did you take into account the impact that it would have on Melburnians' mental health?
I said yesterday that everything was on the table, and we had meetings well into the evening last night of the Coordinating Ministers Committee. There were meetings this morning of that committee again. Many phone calls back and forth with the public health team and senior officials, myself. It was a long night. We have made, I think, difficult decisions on advice. We had no advice to go further. It's not like there's anything been left on the table, Nick. We follow the advice that's provided to us, and these are tough choices. And I certainly can't rule out going further at some point in the future. But now, on the issue of takeaway, we've seen some pretty ordinary behaviour last weekend. But and what makes me angry about it, it's not so much that act, but the fact that it takes so much attention away, and it kind of devalues the work that hundreds of thousands of business operators are doing. Fine work, really being diligent and working hard to maintain the highest of standards and to provide takeaway food and coffees and things of that nature in a safe way. I believe that is safe, and I have no advice to change those settings. If I got advice, though, I would, but I don't have that advice.
Which one of the factors that was taken into consideration, the effect on Melburnians' mental health?
Oh, mental health is a factor in all the decisions we make. We know and understand that we know and understand that lockdowns come with a price, and that price is measured in lots of different ways. Mental health is one of those issues that's weighed up. Opening up, though, against advice, pretending it's over, letting it rip, as it were, that'll come with its own price too. And that'll mean many thousands of people in hospital, and a good portion of those people who will not go home. And there's a lot of mental anguish involved in that too. And we've been there. We've been there last year. We don't want to go back to that, and we're doing everything we can. And we can be quite positive. The cases are but a fraction of what's occurring in other parts of the country. We have acted early at the earliest possible opportunity, and that's a two-edged thing. I know that means that regional Victoria today is only getting a few hours' notice of some really significant changes. I regret that that's the way it has to be. But this Delta moves so fast, and I don't want anyone to be able to look at the decisions we've made and say, oh, look, you absolutely could have acted sooner and you didn't. Like, we're being as quick, as rapid as we possibly can be.
On that 2 hours notice, a Meatong pub owner is quite outspoken. He's wondering why you've only provided such a limited time frame. Why only 2 hours notice?
Because that's the advice, and if we wait any longer, we may well see more cases. And cases today mean hundreds and thousands of cases tomorrow and next week and next month.
Did we wait too long targeting Shepparton, given that we knew wastewater results were coming back?
No, I think we've had a pretty intensive effort in Shepparton all throughout this week. I want to send a message to the Shepparton community. They did an amazing job last year. I know they will do it again. They will come out in their thousands to get tested. That in itself presents a bit of a challenge. We've got 3 sites, as Jerome's taken us to. They've got expanded hours. We're throwing everything at it. But we need people who are connected to the outbreak in the first instance to come forward, and then we'll communicate, tonight, tomorrow, about other people in the Golden Valley coming forward and getting tested. They're a proud community, a strong community, and I know they will do the right thing. They will come out and do the right thing, and we have been actively involved, actively engaged in that community. It does go to the point, though, about if you've got symptoms and you don't act on those symptoms, if you wait days, then you almost certainly will infect others. That's why you've got to go and get tested. We've said it so many times because it's true. It's so important. If you've got symptoms today, you've got to get tested today. You can't wait till next Wednesday, because everybody you go anywhere near between now and then, if you've got this, and you have to assume you have, Delta, you will give it to your whole family. And everybody else you see and are in the company of, even strangers, you will give it to everybody. That is how infectious this is.
Did you consider locking down Shepparton earlier, given that we knew the wastewater test results were coming back positive?
Yeah, we wouldn't. Yeah, we wouldn't lock down. Well, look, I don't think locking down individual communities works. I just don't think that it does. And when you already know that there's been movement to other parts of regional Victoria, then the notion of trying to divide regional Victoria up into different sectors, that doesn't work. It just doesn't work. And again, I'm not here to comment on other states, but this kind of localised approach, I think we will not be doing that, because I have no advice to do that, because it is the view of common sense tells you it just doesn't work.
Through that targeted lockdown.
Well, hang on, let me finish. We don't lock places down off sewage, right? Off a ping, off a test. We need positive cases. Sometimes people will come forward and be very prompt to act on their symptoms. Sometimes, for a multitude of reasons, people won't do that. We can't change what's occurred, but what we can do is, again, plead with every single Victorian, no matter where you are, no matter whether you've been anywhere near an exposure site or not. If you've got symptoms, you've got to assume you've got COVID. You've got to come forward, get a test, and we will support. Hopefully it's negative. And you've played your part, you've stayed inside for a day, because we're getting 99% of results back the following day. If you're out of pocket because you're doing that service for all of us, we will give you the $450 to look after you and look after your family. But being prompt to test is incredibly important. Incredibly important. Sewerage is a really important. The sewerage detection and surveillance system is very important. But that's why we've been out in the community all week in Shepparton asking people to come forward and get tested. Because there was a ping.
Why did it take so long then to find this positive case, given we had that messaging? And are those three households, are they family relatives, or are they only connected by the schools?
I won't go into. They are large families. They'll be connected with lots of different ways. The schools connect them. Sporting clubs connect them, as I understand. There may be some familial connections as well. What you're really asking me is, the sewage went off on one day, and then a number of days later, we are in a position to make these decisions because we've got advice to do so, because we've got cases. It's the intervening period. I'm saying that's an example of people who we would have liked perhaps to come forward and get tested a bit earlier. It's not a sense of blaming them. We can't change it. All I'm saying is it's an example of what can happen, and it's not necessarily true of every case in Shepparton or even every case we're reporting today. But in the numbers we're reporting today in Melbourne and beyond, we know that there are some people who have not necessarily gone and got tested quite as fast as we would like them to. We're just appealing and asking, please act on your symptoms as soon as you register those symptoms. Otherwise, with this Delta strain, you'll just give it to everybody you love. You'll give it to everybody you live with. You'll give it to everybody you come in anywhere near. That's the nature of this.
18 months into this pandemic, Jerome mentioned it, and you've just mentioned it as well.
Yep.
Why is it that people are still reluctant to come forward when they've got symptoms?
Yeah.
You've been talking about this for at least 18 months.
Indeed, feels like longer. And so many people have been listening, and I'm sure it feels like longer to them too. I don't think it's a reluctance. I think that there is always a bit of complacency. There's always a bias towards assuming you've got this. It's also, I think, people look to Victoria and they look at the numbers and they compare them to what's happening in other parts of the country, and maybe there is a percentage of people who think that, oh, well, they've got that under control. The rules are for someone else to follow. The prompt is for somebody else to act on. I just say, whether we like it or not, we're all in this together. The virus doesn't discriminate. The rules don't discriminate. Now, sadly, this lockdown doesn't discriminate. It is across the whole state because that's the advice I've been provided with. And I just say to people, whether they're at Meetung or wherever it might be, if this thing can get from Sydney to New Zealand, then I really don't accept the argument that it can't have gone beyond Shepparton and Bendigo. It went from Sydney to Melbourne to Mildura only a few weeks ago. We have to assume that it's out there much broader. We also have sewerage tests down in the east of the state, I think down at Lakes Entrance. So I understand the frustration of people in business. I understand the frustration of so many people across regional Victoria, but these decisions are not made lightly, and they're not made without strong foundation and strong logic and science behind them. And that's why we're standing here making them today.
We've seen the numbers go up quite significantly.
Lakes Entrance, I think, is where that ping has gone off. There's every reason to believe this is further into regional Victoria than positive cases would tell us. Hopefully that's wrong. Hopefully, as more and more regional Victorians come forward and get tested over the next few days and weeks, hopefully there aren't positive cases. But you've got to assume that there are, particularly when you've got wastewater detections that tell you that the virus is there.
But what's your message to those regional Victorians that might be 8 hours away from a case and are having to shut down businesses?
Well, it's 8 hours away from a case that you know of. There's been movement for instance, if you're in Bendigo, the first assumption would be when you hear there's an outbreak in Shepparton, oh, well, that won't affect me. But then when I tell you that at least one person who was positive with this virus travelled to Bendigo, all of a sudden that picture changes. I'm sure that nobody in Mildura thought that the outbreak in Melbourne would finish up in their local area. I'm sure that people in Dubbo never thought that an outbreak in the western suburbs of Sydney would finish up in the far west of New South Wales. It's got to New Zealand, for heaven's sake. This moves rapidly. We always have to assume there are more cases than we know about, and the spread of it is wider than what the data tells us. That's just the way this is. And again, I wish I were not here having to make these announcements. If we were all vaccinated today, I wouldn't have to make these announcements. That's why everybody who can go and get vaccinated and pick up one of those 80,000 appointments this coming week, you will take us a step closer in the race to 80%, when then lockdowns will not be a feature. They will not, on our national plan, highly, highly unlikely that you would have any statewide lockdown. Masks may still be a thing, some rules may still be there, but the notion of everyone being locked into their home and Victorians being locked out of their state, we'd hope to be able to change all of that once people have gone and got vaccinated. I don't have enough to vaccinate everyone, but I do have enough to vaccinate at least another 80,000 people based on how many appointments there are today. These are vacant appointments. They're empty. If you turn up with confidence, we'll get the jab in your arm.
We've seen numbers go up.
I know a lot's been made of playgrounds being closed and so forth. What's your message to parents who are particularly worried perhaps about the mental health and the development of their young children?
Well, look, we got through this last year. We will get through it again. There's every reason to believe that the fast action, the steps we've taken, the fact that all of us as a community are I hope, doing the right thing, playing our part. These numbers are low by comparison with other parts of the country. We can keep them low, but only if we all play our part. If everyone assumes it's someone else's job, then these numbers will grow. And we know what Delta does. It doesn't grow, slowly. It will rapidly expand. And then it will be away from us. And then all the options and all the different choices that we hope are available to us in September and October and November, well, they won't be available to us. It'll be much like what's happening in Sydney, where they have very limited options unless and until they get to that 80% mark. So I understand it'll be challenging for parents, some of whom are working from home and will now not be able to, not all, but some that are working from home that will most likely not get a permit. Some will, some won't. This is the same rules as last year. It's very challenging, I know, and we would not take this step if we didn't believe that it would be effective in limiting the spread of this virus. If we limit the spread of the virus, then we limit these lockdowns. That's true, and so too is the exact opposite. If it spreads, then we will be locked down for longer and we will have less options.
Speaking of it being effective, Sydney's been in lockdown for a lot longer than us. We've been in
Indeed.
lockdown for 2 weeks, and 2 weeks ago I'm sure I heard the phrase that we will get these numbers down. How high are we expecting it to get under our current set of restrictions
Look,
if people are doing the right thing?
Sure. What I can say is this. There's some big families involved in this Shepparton outbreak. In fact, big families have been a feature of these cases we're dealing with now for the last 2 or 3 weeks. So, and the thing is what they call the attack rate of this thing. Like if there's one case in a household, literally everybody in the household will get it. The question is, numbers tell you one part of the story. It's what sits behind those numbers. If people have been in ISO, they've been away from others, then the numbers, we don't want more cases, don't misunderstand. But if it's a case that's in isolation, then that's not a risk to us in terms of public health. We all know, we can be certain that if we don't follow the rules, we'll have more and more cases. They won't go down, they'll go up. So that's why I'm appealing to everyone, please stay at home, please follow the rules, please take the rules seriously. There's only so much that our nurses can do, our paramedics, our contact tracers. They're chasing harder and faster than they ever have. There's only so much, dare I say, that the government can do. You know, we can make these decisions, we can resource everything, we can work, night and day, but it's on every single Victorian. And that's why I'm asking you, not just as the Premier, but as a dad, from my family to yours, from the government to you as Victorians, for every reason, we have to follow these rules. No one's exempt from them. Because if we don't follow them, case numbers will go up and we'll be like Sydney. And I don't want that.
Sorry, that didn't really answer my question. Is there any modelling to suggest, given, I'm asking specifically about the story behind these numbers. We know the numbers don't look good at the moment, but given the stories behind them, how much worse are we expecting this to get? And what? Well,
I'm sorry if I didn't specifically answer your question. I don't have a crystal ball, and I can't tell you whether it's going to be 100 or 200 tomorrow. I don't know. We have to wait and see. What I'm saying to you, maybe I could have been, I'll try and be as clear as I can be. If we don't follow the rules, I will be reporting. If we don't follow the rules, I'll be reporting more cases, not less. And the jumps will be significant because this thing moves so fast. I can't tell you what tomorrow's numbers will be. I can't tell you what it'll look like in a week. What I can be certain of, these tactics, this strategy has worked before, not just against the 2020 version of the virus, but the Delta variant. It can work again. But the strategy is not, it's not a speech or a law that's passed. It's not something that's done away from individuals. It's a strategy that involves every single Victorian playing their part. Millions are. Some may not be. I'm not making judgments about what you did yesterday. I'm just appealing you to make the best choices today and over these next few weeks, and that's how we will drive these numbers down.
But to Mark's point, this was intended to be a 7-day lockdown, so can we have any indication of how long this will
There's
progress?
never been, I'm sad to say, there's never been a crystal ball with this. We'd all love certainty. It's a global pandemic and the virus has changed and it's different than what it was last year, but we beat it last year and we've beat this variant. We can do it again. What I'm saying to you is that we are certain to fail, though, if we don't all take this seriously. So today I think we can be very hopeful about the fact that these numbers are low and we've caught some of these early. Others, not so much. People have been in the community for a long time with this virus and we are assuming that it's more broadly in country Victoria than the numbers would tell us. But look, Victorians know what to do. We've done it before. We know what to do. And we also know what not to do. Trying to ignore it, trying to pretend that frustration and anger works against this virus, it doesn't. If getting angry meant you were protected from this, we'd all be vaccinated and we were all vaccinated a long time ago. But it doesn't work. And that's why we have to be vigilant.
There's a significant Indigenous community in Shepparton.
There is.
I wondered if there's any information about the vaccination rates around that cohort, or what are the risk profile for it getting into that community?
Sure, look, we can come back to you with some details around that. I believe that our Indigenous vaccination rate is higher than some other parts of the country. It's still not high enough though. We've made a good start. We thank our Aboriginal Controlled Health Organisation partners and others and all the team who are working on that. There are many vulnerable cohorts in the community. First Nations peoples are one of them. There are many others. And we're working through each of those in a diligent way. The state effort, we're at now over 2.1 million jabs that we've done through our state clinics. That includes some of the outreach we've done to vulnerable groups. Happy to get you some further data around that. This is a big challenge for the whole country, and some of the numbers, they just aren't high enough, and we've all got to work together and each play our part, each state, each territory.
There's also quite a transient community in terms of work in the agriculture sector
Yes.
there. Do we know if either that's how it got into the area, or the risk now of it spreading across other agricultural areas?
No, I wouldn't assume that there's a heightened risk around that. We well understand this community. This community well understands what it has to do. It's done it before, and we all remember long queues, really quite amazing efforts that people went to play their part to get tested last year, and I'm confident the same thing will happen again. As I said before, proud community, strong community. There are some there that are vulnerable. We will look after them, but the Shepparton community knows what they have to do. The Golden Valley knows what they have to do, as indeed I think country Victorians do. Like, as frustrating as this is, people know and understand. It's gone from Sydney to Melbourne to Mildura, Sydney to Western New South Wales to New Zealand, for heaven's sake. Like, it moves, and it moves fast.
How much consideration was given to closing down the construction sector, given how much movement there is around the city at the moment?
Significant reductions to 25% are a very. They are having a very significant impact. So I wouldn't suggest that the steps we've taken are small steps. They're quite significant. I think we've got the balance right there. If I got advice to go further, we would, but we haven't got that advice. We think 25% is a really significant reduction in the numbers of people that are moving around. Of course, there are different settings for large projects versus smaller ones, indoors versus outdoors, all of that. But they are essentially the settings from last year. They worked then, and I'm confident they'll work again now.
In the abattoirs and distribution sectors,
Yes.
You're going back to the rules from last year.
In Melbourne, we are. Construction, the 25% is statewide now. The higher risk industries are Melbourne now, but we are, and that's with some reductions down to 90%, 80%. I just want to reassure people there will be adequate food on the shelves. It will not affect, in global terms, it will not affect the amount of things that you need. Hopefully doesn't have to run as long as it did last year, Nick. I can't rule out that some regional businesses don't get ultimately caught up in this. We are looking at that and whether it would have an impact. But today's announcement, it relates to those higher risk industries in Melbourne, and we can get you some further details. We're going to be speaking with each of those businesses and making sure that they fully understand. They won't be pleased with this, I know, but they'll know it because they did this last year, and it's modelled on last year.
Gladys Berejiklian has spoken just while you've been speaking, and she said she wants to thank premiers who she said she's noticed a shift in their attitude towards what Delta means. The implication is that perhaps not getting back to zero, and that Delta poses a new threat. Is that your still understanding, that the National Cabinet agreement is to aim for zero?
I'm always loath to comment on comments I haven't seen. I'm not for a moment doubting how accurately you've put that to me, but context is everything. Let's be very clear. There was a National Cabinet meeting yesterday. The plan is the plan. If you don't actively suppress this virus, then when you do open up, we will have scenes the likes of which none of us have ever experienced in our hospitals. That's why yesterday, far from a sense of easing or a sense of moving away from the plan, there was an agreement and quite some discussion about the need to update the Doherty modelling, because the Doherty modelling is not predicated on 10, 12, 15, 20,000 active cases in any state or across our nation. It is in fact predicated on very small numbers of cases. And even then, there is significant impact on our hospitals. You will not find me make decisions that essentially have our nurses as some kind of, drip tray for this thing, the last line of defence, where we open everything up and we declare freedom and then there's literally thousands of people in hospital. We'll get to 70, we'll get to 80, we'll be able to make big changes. But we'll be able to make more changes and have more freedom at 80% if we go to 80% with very low case numbers. That's why we need to suppress this virus now. Otherwise, we'll simply be saying, oh, well, I haven't got it, I got vaccinated, I'm fine. And there will be a bunch of people who can't get vaccinated for all sorts of reasons. And then, our hospitals will just be a war zone.
But is it low case numbers, as you said, or is it zero case numbers that you're aiming
Well,
for?
the aim is zero. That is the national plan. That is the national plan. Or as close to it as we can get. We've always, it's not an absolute thing. It's not, as binary as that, perhaps. Again, you could have one case, but if that case was in ISO, for instance, if you had a good handle on all the close contacts of that person, so on and so forth. Again, I don't want to be commenting on comments I haven't seen, but the meeting yesterday couldn't have been clearer, and the Prime Minister's statement afterwards couldn't have been clearer, and I'm sure if he's out today or tomorrow, he'll be as equally clear with the people of Australia as he was with all of us yesterday. This is the plan, 70 and 80, and we're best if when we get to 70 and 80, we have low case numbers. If we just open up, let it rip, then we will have a massive problem in the lead up to 70 and 80, and indeed after then, because the hospitals will just be full and the staff won't be there to provide care, not just for COVID, as I've said many times, but for all the other worthy things those staff do. Car accidents, strokes, cancer, heart attacks, all those sorts of things.
No one's suggesting we let it rip, but as
Oh,
Brett
well,
put,
what's-
as Brett
there might- there are
we're
some.
buying ourselves
There might be
time.
some people out protesting today
but
suggesting exactly that, Mark. So, yes, there are.
That's
I'm
a
afraid there are
minority.
people.
I'm just saying, for the majority of people, Brett mentioned that we're buying ourselves time.
Yes.
Are we essentially just going to stay in these restrictions until we've got 70-80% vaccinated, given that the numbers are continuing to go up? Like, what is a fair timeline for Victorians to expect?
Hang on. I'd love to be able to answer all of that and give you a timeline that was chiselled in stone, right? I'd love to be able to do that. I can't. What I can say to you though is we will be overrun by cases if we don't have these rules on. These rules give us a chance to be open before and have some freedoms that we don't have now before we get to 70 and 80. I'm not talking about full opening. I'm talking about, having got it down to very, very low numbers, then we can go back to the settings we had 2, 3, 4 weeks ago. That's the aim. That is the aim. What you can be certain of is that those options are not available in New South Wales. They're just not available. We don't want to become and be limited, as they are, to a pretty well a hard lockdown all the way until the 80% mark is reached.
I suppose my question is, at what point is that not an option for us as well? When do we just have to succumb to the fact that we're waiting for vaccination?
We're a long way from that, and we are throwing everything at this, and I need every Victorian to join me in the effort to keep options alive, to keep people alive too, just quietly. This is not good to get, and it will overwhelm our hospital system, and if people don't stay at home, then there will be a lot of people, thousands of people who are staying in hospital, and some of them will not get to go home. Some of them will not survive that. And I'm not just talking about people that we can somehow rationalise that someone who's in the twilight of their life, maybe that's not something to worry about. I don't agree with that at all. Besides that, this is very much outbreaks and a wave, if you look at what's happening in Sydney, of younger people. Younger people in hospital. There's hundreds of people in hospital in Sydney, and that's very, very challenging, and we don't want that here, let alone thousands.
Do you have any modelling or health advice that what Mark is talking about is possible or probable, that we will have these cases all the way until we get to 80%, which is November, December?
No, I don't have modelling that suggests that. I do have modelling that's very clear that we will not have, like the Burnett's done all sorts of modelling. The Doherty modelling, if you look at it from a slightly different perspective, it's telling you a story that if you didn't actively suppress this virus at 50% or at 60%, so if you're short of the 70 and the 80, then you don't have options. Like it is a meltdown. The system collapses, and so many people die. That's how fast it moves.
Even if every Victorian did the right thing from now, is it realistic to say that 2 weeks is enough to bring this under control?
Well, what a terrific problem to have. If every Victorian does the right thing, we will be in a much stronger position. I cannot tell you. It's not this. This is not new, by the way. The notion that I didn't have a crystal ball last year and I don't have one now. And what I can be sure of, and what all Victorians can be sure of, if we think the rules are for someone else to follow, if we think that we're bulletproof and we're young and healthy and we don't need to do the right thing, or we're tired and angry and frustrated and somehow that works against the virus, if we act like that, then these case numbers will go up and we'll be like Sydney, locked in until we get 80% of people vaccinated, and that is months away because I don't have the vaccines now. If I had them now, then we wouldn't be at this press conference. We'd be out, with lines that stretch from one end of the state to the other, vaccinating everybody. But I don't have those supplies. I just don't. I do have 80,000 open appointments. Please book one of them and get your jab this week and help us in that race to 80%.
Premier, sorry, just on that. Before we get to protest, I just wanted to know, following on from Mitch's point, what do you make of Jet Kennett's tweets that food companies have been briefed that big lockdown will last into 2022?
I don't make anything of his tweets or anything he says. He's completely and utterly irrelevant to the work that I do.
He's made a suggestion, and just to take a step apart from obviously the differences you have with Mr. Kennett, but he has made a suggestion.
Well, it's not about differences, it's about fact versus fiction.
Okay, but this is a proposition he has put.
Well, you should speak to him about where he gets these ideas from, because we're here, like we're actually doing the job. We're not, we didn't do it 20 years ago. We're doing it now.
Yeah, okay.
And if people want certainty, then why don't you put it a different way? Ask me the question rather than quoting someone who's irrelevant.
Okay, well, I'll ask you the
completely irrelevant.
Okay, well, I'll ask you the question. There's been a proposition that we could have the grand final in Melbourne if we put the incentive that only people allowed into the ground are fully vaccinated, both staff members and audiences. Is that feasible? Is that something that could or would be considered?
All manner of things will be considered, but I'm not here today to make announcements about the grand final, and no decision has been made about the grand final. And it isn't just about those sorts of issues, it's about many other considerations. I thought the position on the grand final is one that is evolving, and I can't with any certainty talk about where it'll be held and under what circumstances it'll be held. I thought the question was much more about this will go on till 2022. Like, I don't know on what basis that claim's made. This will go on until we get to 80% if these numbers get away from us. If the numbers are low and we drive them down further, then we have options. Many, many options that some parts of our country do not have.
If we provide that sort of incentive for people to vaccinate, say the grand final.
Yeah, sure.
Is that something you would consider or look at? And could the grand final be safe purely on the vaccination ground?
Well, I just make the point. It's not just about the vaccination status of a group of people at an event. It's about vaccination status across the board. Like, some of these comments no doubt are being made by people who are fully vaccinated. But not everyone is. Not everybody is. And people are entitled to their views, that's fine. But you're not entitled to your own facts, right? Just making stuff up. That just doesn't work. What I'm saying to people is get vaccinated, and each vaccination is important, but the rules and how we go forward is not just about my vaccination status or yours, it's about the vaccination status of the entire community. That's where 70% comes from, that's where 80% comes from, it's what the Doherty modelling is all about, it's what the national plan is all about. So, I try and stick to the things that are relevant, and I try and stick to the facts. That's the point that I'm making.
What about just COVID rapid testing was implemented, obviously it was utilised to pick up the Shepparton cases. Could that help see the grand final?
We've had many conversations. The Therapeutic Goods Administration, which is a Commonwealth body, have not approved any such testing to occur on that sort of scale. There is a trial going on at the moment. One-off rapid testing, that's not what's recommended by the experts. If people need refreshing on rapid testing, the Chief Health Officer's here and he can take you to all the reasons why we use it in some circumstances like hotel quarantine, but it works best when you test people every single day rather than a one-off.
Quickly on the process as well, there's talk
Sure.
that there could be thousands and thousands of people there today.
I certainly hope. I hope not.
How concerned are you that that could push us back?
Well, again, if people gather against the rules in any numbers, but certainly in larger numbers, that poses a very significant risk. The virus is out there, and it will spread if people don't follow the rules. And again, I just say, anger and frustration. We're all, none of us want to be here. We all want to be in a different set of rules. We want to be, as I said before, if I had warehouses full of vaccine, they wouldn't be full for long because we would get them into people's arms. I don't have that. Getting angry about that doesn't necessarily achieve anything. Protesting against that doesn't achieve anything. These are the realities we face. If there was a different choice to be made, we would make it. Be no doubt about that. But being out there protesting, you are not doing the right thing. And I think the Chief Commissioner's made it very clear how seriously Victoria Police take that.
Has National Cabinet agreed to combine the federal vaccine record with state check-in systems to allow vaccinated Australians exemptions at places like cafes during lockdowns?
I wouldn't say that there's an agreement that sort of speaks about a finalisation of that work. To your question and to Nick's question, I would say that there's a whole lot of work going on at the moment about what being vaccinated might mean, and I think it's almost certain that there'll be greater freedom, there'll be greater freedom to move in all sorts of different places and spaces if you've been vaccinated. Where you can be vaccinated. There may be some people who for medical reasons can't be. We wouldn't want to discriminate against them, but if you choose not to be vaccinated, then you're making the wrong choice. These vaccines have been through arguably the world's toughest process. They are our way out of this, and that's why I hope that even in the time we've been speaking today, a whole bunch of people have gone online and booked some of those 80,000 appointments I mentioned earlier.
Premier, we're hearing reports that there are brides in regional Victoria who have been made up this morning, but their weddings are after 1 o'clock. Are they allowed to go ahead and have their
No, the rules apply from 1. I am terribly sorry that the rules have to be put on at 1 p.m. If I had different advice, then I would have made a very different decision. But we cannot have a situation where this spreads and spreads and spreads. And we have to assume that there is more of this in regional Victoria than the testing results would tell us. I deeply regret that.
But there will, no doubt, if the whole family's involved with organising the wedding, there will be people who won't be
These decisions are made, these orders will be signed, these rules apply from 1.
So even if how will they be treated if they genuinely don't know about this?
Oh well, that I'm not going to get into. Essentially, that I think you would appreciate that I'm not going to be here essentially drafting a list of excuses to avoid the rules. Well, that's what you're asking me to do. I'm not going to be drawn on commenting about what people knew and didn't know. Everyone is expected to go to their best efforts to understand the rules they're operating under and to follow those rules. That's always been the case.
Given it's so quick, could we do anything like business support for those who have lost events in regional Victoria, in individual events too? These cost thousands of dollars.
Well, there'll be further announcements in relation to business support as early as tomorrow. Sorry?
For people who've lost weddings today?
Well, there'll be further announcements about business support as early as tomorrow.
About the personal cost.
Well, I'm indicating to you that there will be business support announcements made, and if the business is supported, then they're in a position to provide further support to their customers who have been disadvantaged today by decisions that were not made lightly. That's the point that I'm making to you.
Can I ask
You're in no position to provide customers with relief if you haven't been supported. That's pretty logical, I think, so that's why we're going to make business support announcements, and they'll be made as early as tomorrow. Would you like to ask someone else something?
I just wanted to ask Jerome a bit about...
Terrific. Jerome.
Jerome, you said some of today's numbers were reflective of a positive case in the Royal Melbourne Hospital. Can you just give us some details on that?
Yeah, so we're aware of one positive case who's an inpatient at the RMH. We've identified a possible connection to another patient. We are working those through at the moment, so we're expecting a sort of a growing investigation there. Obviously, a lot of work being done now by the RMH. They'll be deploying their normal COVID protocols. We do have strong protocols in place, particularly within our metro hospitals, and we'll be working with them over the coming days and hours to see how that runs out.
Do you know how long that patient had been in there for, and how many staff have been affected or furloughed?
Not at this point. So this case dropped late last night. So obviously we're working closely with the RMH team to understand what departments are impacted, what their response is going to be. There are well-established protocols that we've had to deploy recently, both at Footscray Hospital, at Werribee Mercy, at Sunshine, all in the last few weeks. And it highlights again the risk of community transmission. When you see it get out beyond an identified core set of clusters and it starts to move into the community, our hospitals and other vulnerable settings are at greatest risk, and that's why we're working with all of our health services, our aged care facilities, to step up all their precautions and measures at this time.
When you say there's been a connection to another patient,
yep.
Are you saying that patient has given COVID to another patient in the hospital?
That is one line of investigation we're following at the moment.
And in terms of investigations about the Shepparton cluster, it's something
yep.
I asked the Premier, but a working theory on how it's got into the community, if there's any risk amongst more transient workers and of course the Indigenous population, any specific detail that the Premier flagged about vaccination rates and the risk profile there?
Sure, so there's quite a bit in that. So let me start at the top. At this point in time, we don't have an acquisition source for the 17 cases in Shepparton. We're very clear the 17 cases across 3 different households are all linked. We understand those linkages. As I said earlier, there's a number of connections into schools, but we do not have an acquisition source for those 17. We're working on the assumption it's Delta. We'll have more when we see the genomics. We don't have a connection at the moment, whether it's connected to the Melbourne cluster, whether it's connected to another incursion from Sydney. That's all work that's still ahead of us. I would highlight, of course, that people in Shepparton are vulnerable at this point in time, and I'd urge everybody in Shepparton to stay home, stay isolated. If you've been to those exposure sites, if you're connected to the schools, then please come forward and get tested. And if you've got contact with those particular individuals, we'll work with you over the coming days and hours. We do have 10,000 vaccination slots available in Shepparton at this point in time over the next 4 weeks. They're part of the numbers that the Premier read out. So if you're keen to get tested but you're not related to those exposure sites, we'll get vaccinated instead. We are keen to see this vaccination surge happen across our state, and that's one thing, a positive thing that people in Shepparton can continue to do, as well as supporting these wider measures. We continue to work closely with our ACCHOs in the area. I don't have the details of vaccination rates amongst the local Aboriginal community, but I know, as I said yesterday, the ACCHOs have been exceptionally active in Victoria, and we'll continue to support them to up the vaccination rate as much as the supply allows.
Do you know how many staff have been furloughed at Werribee Mercy?
Not at this time, Nick. So the Werribee Mercy was an individual who presented into the ED, I believe, yesterday, and we've got a full response happening at Werribee Mercy. I believe there's now a total of 3 cases associated with the positive individual that we know about, and 2 casual contacts, I believe, outside of the hospital. But we'll continue to provide that support to Werribee Mercy.
And it's true that person refused to wear a mask and was speaking.
I'm not going to comment on the individual case, but there were some complexities around that case.
Are we able to just confirm the mystery cases again that you went through earlier?
Yeah, 11.
11. And whereabouts they all are?
I kind of went through those suburbs. They are. That's my point, Mitch. The 11 mystery cases are across a number of suburbs of Melbourne. So I mentioned Footscray, I mentioned Mordialloc, I mentioned Frankston. We've got in Kew. So we've got a number of different cases now spreading that visible map. And I think that's what's really important for Melburnians. We're no longer now working on the basis of here's an identified cluster in a certain geography or connected to a certain set of schools. This is now running widely across the community in Melbourne. It is popping up in just about every suburb, in just about every LGA. So please, this is why all of us now, all 6 million of us, need to be very, very cautious about who we interact with and all those distancing measures that we adopt.
Given the improvement in contact tracing,
Yeah.
why are so many of these cases linked to known outbreaks, but so few of them have been in isolation for the entire time? Given that we do the 3 rings,
Sure.
what's the explanation for that? Is it a failure in interviews? Is it people not being forthcoming with information? Where's the missing link?
Well, look, I think, Mark, if you took this outbreak up to about 3 or 4 days ago, we were very clear. We had a very clear set of clusters. I think we had about 5 or 6 clusters that we were discussing, and very good levels of a large number of people isolating, up to 15,000 primary close contacts. Very high rates of testing, 85, 90% of people in those exposure sites coming forward to get tested and staying locked down. All of our isolation protocols have been really well adhered to by those under that 14 days of isolation, and that's why the outbreak's been kept under such good control over the majority of the last 2 weeks. What's happened in the last 3 or 4 days is we've seen a number of those big acceleration events take place. So we suddenly have 17 cases in Shepparton that were seeded over a week ago. That acquisition happened 7, 8, 9, 10 days ago. We do not know the source at this point. We had the escapades in St Kilda East, again, a couple of other clusters there. We had the cluster now at the Broadmeadows Child Centre Care. So these are all events that are happening now. It is possible that they're incursions from different sources. It is possible that they're leakages from the original cluster. But that is what's different about this outbreak, is that we are seeing a second, third generation of cases emerging, which are beyond the core cluster that we've managed so well.
And given that, I suppose my question comes down to how these people that are getting infected are getting infected. Given that we've had the rules on for 2 weeks, is it visits largely to the home? Is it the childcare stuff? What is a percentage are we seeing that are sort of rule breakers that I suppose we wouldn't be able to stop even with the rules that are currently on?
Yeah, I'm not going to quite go to that, Mark, but I think there's a number of dynamics that we're seeing in this particular set of clusters. One is with a large cohort of far younger people under 10, people in their teens, people in their 20s, who are active parts of these outbreaks. We are seeing certainly connections, outdoor. We've seen some examples of outdoor transmission. That's been much harder to define, and some of those recent clusters from last week were much harder to connect in because people who are strangers to each other seeing that kind of transmission in those kind of exposure sites. We have seen a number of recent clusters get accelerated where we just don't have the acquisition source. It is entirely possible that people haven't been quite upfront about where they may have acquired it from, either interstate or from another part of our cluster. That's entirely possible. But the biggest single factor has been late presentation for testing. And we see this time and time again. So when you see a cluster and you're reporting 10, 15, 20, 30 cases after a day or two, that tells you that people who've been exposed and infectious have been infectious for a number of days. So the single best thing we can all do is stay isolated and stay distant and get tested early. There's no downside to a test that turns out negative. You just need to get tested early.
Just on that Royal Melbourne Hospital case
Yep.
again, sorry. You mentioned the possible transmission from
Yep.
a patient. Which ward was that in?
Oh, I don't have that detail with me.
And can I just ask Mr. Patton a quick question, if I can? Commissioner, yesterday the police ended up closing down the food bank because there were so many people wanting there to collect food. Why did you close it down, and was there any thought to actually trying to manage the traffic better to ensure these people are obviously desperate for food got?
Yeah, I don't have the exact details of what occurred there, other than there was a safety risk posed by the numbers there, etc. So a decision was made, an operational decision was made to close it down, and they obviously are continuing to work with them to see if we can stop a repetition of that. Obviously, we're very keen to make sure that that service is operating and operating safely, but where there's a risk posed to any community safety, the operational supervisors out there make those decisions. So that's what was determined yesterday, but we will now look to make sure in future if we can implement some type of other operational plan when there's a significant demand.
But obviously those people, the desperate people, they needed that food. Was there consideration given to actually being able to try and manage it properly rather than shut it down when people were queuing up desperate for food?
Oh, look, I'm broadly briefed in relation to the matter, and my understanding of that is that the operational supervisors there tried to do what they could, but the assessment was it was required to be shut down, so that's what occurred.
Jerome, do you mind if I just clarify one more thing about the Newport cluster? You said yesterday that it appeared a couple of cases that we knew about had not stuck to their 14-day isolation, and that resulted in other infections.
Yep.
Do we know how many other infections?
No, I don't have a detailed number for you on that, Mark. I mean, there are 6 more cases in the Newport Footy Club cluster today. There are 3 more cases around another exposure site in Newport in today's numbers. And, you know, we continue to remain concerned that that kind of onward transmission is either happening because people are not maintaining complete adherence with their isolation protocols. We've got more home visits lined up in there again over the coming days, or that there is another chain of transmission that's working around its way through the footy club and through the gym. So, look, these are high-risk centres, these are high-risk locations, these are high-risk activities. That's why we need people to be upfront about all the contacts they've had, and that's why they need to be upfront about sticking true to their isolation protocols.
Have those people been fined yet? The ones who
there will be follow-up action, yeah.
And do we have an update on the Footscray outbreak? I know 40 staff were in isolation. Do we know where that's
Look, the Footscray Hospital continues to, those staff continue to work through their isolation protocols. So we have plenty of capacity at the moment in place within our EDs and within our health services. We'll continue to support Footscray Hospital through the normal arrangements.
Is it just the one case so far?
Just the one case, yeah.
Okay.
Are the numbers suggesting we're in for an even worse day tomorrow?
I don't have the numbers coming in yet, but I think as the Premier has said, I expect to continue to see more numbers coming out of Shepparton during the course of today. We've got a lot of testing to do amongst those school communities. We know we've got a number of young people that were active in the community for a number of days whilst infectious. And look, I think with 11 unlinked cases today, we'll be making those linkages today. We'll be working through those primary close contacts today. I'd expect to see more positive results in the days ahead. Absolutely.
Have we solved any of the old mystery cases?
Oh, look, we've connected more of the old clusters to the main cluster, absolutely. But the focus now is less on the noble search for acquisition sources. It's more downstream. The urgency now is stopping this virus in its track. So, although I'd love to be in a position as we've been with the previous 4 clusters or the 4 outbreaks we've had before this, we did wonderful detective work to deal with a source of acquisition and trace it all through. We did some beautiful charts around how it all came together. The focus now is different. The focus now is we've got to stop this thing in its tracks. So if you're a positive case, I need you to stay isolated. If you're a primary close contact, I need you to stay isolated. And we need to work out where else you've been.
If that focus has changed, doesn't that indicate that we have lost control?
No, we haven't lost control, but I think it's now incumbent upon all Victorians. This is an absolute wake-up call. We are, as we said yesterday, we are right, at the tipping point of where this outbreak goes. Over the last 34 days, we have kept an absolute lid on these Delta outbreaks. We've got it back down to 0 again only a couple of weeks ago. It is bubbling up now. It is exceptionally active and dynamic. We've got multiple exposure sites, multiple unlinked mystery cases. So it's how we all behave over the coming days that will determine where this goes. We haven't lost control of contact tracing. We know where the cases are. We know where the PCCs are. We'll be doing home visits, and we've got thousands of people working out there. in testing centres, vaccination centres, contact tracing, to support and back up the community to do the right thing. But we need 6 million people to do the right thing. We can't do it on our own.
As you mentioned, it's seeped into most parts of Melbourne. I think you said the other day
Yep.
that it's easier to name the suburbs
Yep.
where we're not finding traces of COVID. So are we confident that we're on top of
Yeah, look, I think look, we've been here before. We've been here before where we've seen these significant, fast-moving outbreaks. We all know as Melburnians and as Victorians what we need to do, but we can't become complacent, and we can't let go of the rope. And I know it's hard, and none of us wants to be in a position where we're locked down on a beautiful day. None of us wants to have to do this whole isolation thing again for a number of days and probably a number of weeks as we get through these remaining cases. But if collectively we succumb, as Mark said, then the world ahead of us is what Sydney looks like. That is literally hundreds of cases a day and thousands of cases in the community. We do not want to go there because the pressure on our healthcare system, the pressure on people being sick and dying will be horrific. Donovan?
So there's a very simple message today. These are incredibly difficult decisions, but they're based on the best of health advice. None of us want to be in this position. Nothing about this virus is fair. But let's be really clear. If we don't make these decisions, then we will finish up with thousands of cases, our hospitals full, our nurses and other staff under enormous pressure, and many, many people will die. Because we're not all vaccinated. Some are. Hopefully more people will get vaccinated today. There are those appointments available. Please ring and make one of those appointments, then keep it. Turn up, get your jab. The race to 80% is very real, and we can do it. And then the rules change. Then everything changes, and for the better. That's what we're aiming for. In the meantime, we've got to keep pushing these cases down, and that is painful. It's very, very challenging for a lot of people. I wish it wasn't like this. I wish there were other choices that could be made, other options. There just aren't other options because we don't have enough vaccine and we don't have enough people vaccinated. Can't change that other than booking an appointment today. The last point from me, please get tested today if you have symptoms today. Please go and get tested. There's arguably nothing more important that any of us can do. Act on your symptoms, get tested today, and we'll get you your result tomorrow. Hopefully it's negative, but you'll know you've played your part, a massive part, in us getting to the other side of this. Thanks very much, everyone.